Hello, good afternoon, everyone.
Thank you for joining us today.
Oh, thank you for having me.
I think we're ready, Rob.
Yes, thank you.
Okay, recording is on.
Good afternoon and welcome to the St. Louis County Department of Public Health Medical Moments Update, rescheduled from February 11th until today. We thank each one of you for joining us. I am Damon Broadus, Division Director for Health Promotions and Public Health Research at St. Louis County Department of Public Health. Again, we thank you for joining us. Before we start, I have a few housekeeping duties. It would be helpful if all attendees are aware that we are using a new, more secure platform called WebEx Events. WebEx allows our panelists to speak without interruption or to finish their presentations and provide vital information today. It's very important to DPH that we allow time for a Q&A session at the end of today's program. If you have a question, please use the Q&A box in the lower right-hand corner of the screen. This is opposed to the chat box. Use the Q&A feature, please. Last comment, please know that the meeting is being recorded and we will be available on our DPH channels in the next 7 to 10 days. In observance of Black History Month, we have an information-packed session featuring St. Louis County Executive Dr. Sam Page. Thanks to his vision, the North County Outreach Group was created in early 2021 when the COVID vaccine was first rolled out. We have leadership from both St. Louis County Department of Public Health and the City of St. Louis Health Department serving as host. Our leaders from the North County Outreach Group will join us as speakers, highlighting what the Black community needs to know about COVID-19. The highlight of today's Black History segment are reflections from the descendants of the men who were victims in the United States Public Health Service syphilis study in Tuskegee and Macon County, Alabama, from 1932 to 1972. We are proud to have the interim president of Harris Stowe State University joining us to give a brief history of the university and to encourage young adults to protect and honor their elders by getting vaccinated. We start today's conversation by introducing St. Louis County Executive Dr. Sam Page. Please welcome Dr. Page.
Thank you, Damon, and thank you to the organizers for rescheduling this event. It's a shame we got interrupted last time. I look forward to hearing from and learning from our speakers today on a topic that's been a priority of my office since the beginning of the pandemic. When the first case of COVID was confirmed in St. Louis County 2 years ago, we knew that our response had to be based on one where the need was the greatest. And that's why testing sites went up quickly in North County when St. Louis County had access to tests. And when we had access to vaccinations, the first mass vaccination center went up in North County at Florissant Valley Community College. Generations of health disparities have resulted in deadly consequences for St. Louis County. African Americans were disproportionately impacted by the virus in illness and in death. But we're committed to an equitable response to this virus, and that commitment continues today from St. Louis County. Our health departments have worked hard to build trust with the community, and we recognize that our community has reason to doubt government treatments for this new virus. I want to thank our public health departments who've been on the front line since the beginning of this pandemic. The mission of public health is to help those who need it most. And our health departments have stepped up time and time again. Across the country, we've seen health directors come under attack for simply doing their job, trying to save lives. Directors and their family members and public health workers have faced all kinds of threats. Public health departments designed to be a refuge found themselves under attack, with directors leaving to protect themselves and their families. But I want to stop talking now. I'm here today to listen, to learn, and I'm excited to hear what our program is going to bring us. Thank you, Damon.
Thank you, Dr. Page, for the leadership and relentless public service to the residents of St. Louis County. I want to take a moment to introduce Dr. Faisal Khan. He's St. Louis County Acting Director of Public Health. He will share with us a public health update and other issues facing us as we move forward with this pandemic.
Thank you, Dr. Page, for those words of encouragement and for your leadership during the worst public health crisis in a century or more. My friends, when Damon first mentioned this occasion, I had goosebumps at the mention of the Tuskegee experiments, because those of us who've spent a career in public health understand only too well the damage done to trust and credibility for public health and science as a result of that 40-year-long criminal enterprise. And yes, I don't consider that a mistake. I consider that a crime. We are still paying the price for that. Someday, once this pandemic is over, perhaps decades from now, when complete history of COVID-19 is captured, there will be a segment dedicated to finding out and estimating the loss of precious human life directly attributable to the mistrust created by the legacy of Tuskegee. And it will be, I fear, a staggering number. Those of us who commit to working in public health throughout our lives are a strange breed. We do so not for money, but because this is a calling in life. And I have no hesitation in telling you that our work is far from done. In fact, we have our work cut out for us. Even as our efforts in COVID-19 continue to bear success and bear fruit, the situation related to the Omicron variant continues to ease off. Our efforts to recover, to bring back people who have been lost to the fold of care in terms of primary care services continues. And that will take a lot of doing. I will share with you a statistic that came out of an excellent and milestone report published by the Forsake of All Project at Washington University, then led by Dr. Jason Purnell, an ally of public health and our department specifically. The 30-year gap in longevity between a child born in Kinloch today and a child born in Far West County should shock us. That is reality. And that 30-year gap in longevity or lifespan did not just open up overnight. It took decades, perhaps more than 50 years of neglect to bring that about. That is the essence of the fight that public health is involved in. Health equity is at the very core of everything we do. What does that mean? Health equity to us simply means that the right to health is a basic public health, is a basic human right. The zip code of your birth should not determine how long you live or what the quality of your life should be, or whether you fulfill your true potential in life. Until we have that situation in this country and in this region, our work will be far from being over. I welcome you all to this forum. I welcome your comments, your feedback. We look forward to learning from you, and most respectfully and most humbly to the guests invited directly in relation to those Tuskegee experiments, I say to you, we look forward to learning from you and to strengthening public health and to ensuring that we build trust and strong, sustainable relationships based on trust with the community. Thank you.
Thank you, Dr. Khan, for your relentless leadership as well, and explaining what we consider the root causes of the mistrust when it comes to COVID-19 and the vaccine, as well as other healthcare issues, linkages to care, root causes of racial and health disparities, as well as the ongoing inequities that we face as a region and as a country. With that said, I want to take a moment to introduce Ms. Valerie Newbern. She's the Public Health Program Supervisor with the City of St. Louis Department of Health, and she represents the city on this call today. Thank you, Valerie, for joining us.
Thank you, Damien, for having me. I'm going to be presenting 2 slides today. I'm going to go ahead and share my screen. Okay. Can everyone see my screen?
Yes.
All right. So, as Amy said, my name is Valerie Newburn. I am the Public Health Program Supervisor here for the City of St. Louis Department of Health. We're going to talk about two slides, go over two slides today. These two slides will show our COVID numbers over the last 3 years and the most recent since January of 2022. What you see here on this first slide here is an overview of the city epidemic curve and metric for the past 3 years. Right here starting in December 2021, all the way up into February, 2 years, 1 year, sorry, February 2022. As you can know, it's our peak average cases was about 517 cases back in January, and as of now, our 7-day average case count is about 26 cases per day. We have seen a 46% decrease in case count compared to last week, and currently, per 100,000 case count rate, we still fall substantially within the transmission through the CDC, and which is great for us, and we'll expect it to hit our goal within the next few weeks. Also, right here, as you can see, our 7-day average is around and about, our 7-day average for PCR testing is about 5.0%, which is great for us, and it is continuing to drop as the weeks go on. That is a big drop compared to our highest peak, which was 35%. So now we're down to 5%, and we continue to see a change. The next slide we're going to talk about is the vaccination within pediatric cases from ages 5 to 17. What you see here is a breakdown of cases within city population, breakdown within zip code. And then right here to the left side, you will see each zip code broke down by race. And as you can see, is that as of February 18th, 47.1% eligible school-age children have received at least 1 dose of COVID vaccine, and 38.1% have completed the series. It also shows that children living in a predominantly African-American zip code have a much lower vaccination rate, which is here. Vaccination rate showing at 29.7%. And that means that they at least received 1 dose of vaccine, compared to the 69.4% in children in the predominantly Caucasian zip code. So what does this mean? So this means that so what do we know? We know that unvaccinated children are more likely to suffer from secondary consequences from COVID exposure and infection, such as not able to attend school, so they're decreasing the loss of learning. So how can we improve those numbers in these communities and the African-American communities within the city of St. Louis? We can improve those numbers by doing several things. One, we want to improve vaccine hesitancy among parents, and we do that by partnering with our community partnerships within those communities. And we're also working with SLPS to bring more education and awareness to the students and the parents on COVID vaccine and the importance of vaccinations for their children. We're hoping in the next few weeks that we can see us increase in vaccination rate in our communities that are affected. So we're going to continue to work on those things and bring more awareness to those communities. I am here to answer any questions that you guys may have later on. Please let me know. Again, thank you for having me.
Thank you, Valerie, for joining us today and sharing your time and providing us insight on the statistics within the city of St. Louis and why it's critical for African Americans, specifically children, to get vaccinated. So we look forward to our ongoing partnership and working with each other to reduce those disparities, because those disparities, we're witnessing those rates in the county as well, almost a rate of 5 to 1 when we talk about white children getting vaccinated in comparison to African American children. So look forward to the partnership, and thank you. Next, we have the person I consider the Surgeon General of our North County Outreach Group, Dr. Monique Williams. She's a physician and president of Mound City Medical Forum, which is the local chapter of the National Medical Association. Dr. Williams will be sharing her slides. Unfortunately, her video isn't working today, but she has joined us via audio. So thank you, Dr. Williams, for all that you've done throughout the last year, sharing your time, talent, and treasures. Uh-oh. If you're speaking, we can't hear you, Dr. Williams. Rob, any technical assistance you can provide?
I'm unmuted. Can you hear me now?
Yes, I can hear you. Yes, we can hear
Okay,
you.
good. I remuted and unmuted a few times.
And
Perfect.
we see your video,
So,
by the way.
yeah, technology is behaving. It's wonderful. So, as Damon had mentioned, my name is Dr. Monique Williams. I am the president of Mound City Medical Forum, the Missouri chapter of the National Medical Association. I'm also the medical director at New Horizons Living, which is a model of care for older adults that tries to achieve health equity and help by helping people to remain in the community with a spectrum of care services that support their needs as people become more medically complex and age in place. I wanted to provide a little bit of Black history in terms of Black History Month. We've all heard about Edward Jenner and vaccination for smallpox, but that's not where the story starts. In 1716, variolation, which was a predecessor to vaccination, was introduced to the American colonies by a man from Africa named Onesimus. It's not his original name. Cotton Mather named him Onesimus after the slave in the Old Testament, and helped to facilitate his freedom. So he asked Onesimus one time, because he spent a lot of time trying to make Onesimus into the first Puritan zealot of African descent, which was not a successful goal, but they did a lot of theology education together. And he asked him, "Did you have smallpox when you were a kid in Africa?" And Onesimus responded, "Yes and no." And one thing to note that we often didn't learn in school, medical science in Africa was far, far more advanced than at Western medicine. So while Western medicine was working on mustard poultices and leeches and a little bit of mercury to treat various ailments, in Africa, women were performing C-sections centuries before they were successful in the Western world with sedation and sterilized equipment. So Africa had a lot of medical knowledge that was pretty impressive. And so, sorry, one second. My slides are okay. There we go. So Onesimus showed Mather a scar in his arm, and he explained that when he was a child, he received variolation or inoculation against smallpox and never developed the disease. He explained that a small amount of infectious material from someone who had smallpox was applied to a clean wound on a healthy person, and the healthy person would never develop smallpox. And he educated Mather on how this method occurred and the much lower rates of smallpox, which was a very contagious disease that often resulted in death. In fact, there had been huge outbreaks of smallpox in a lot of the shipping communities in the American colonies, resulting in massive deaths for children and adults. And so Mather promoted the idea, and actually the Continental Army under General Washington's order required this variolation mandate because they were losing soldiers at a pretty high rate from smallpox. So he mandated that everyone get variolation to prevent death. And if you think about it, and it was very effective. So it was used in communities throughout the colonies and was used for the Continental Army. And so if you think about that, through Onesimus's guidance, this had a huge impact. In all likelihood, because there had been numerous smallpox outbreaks with deaths in young men, we probably wouldn't have had sufficient manpower to win the Revolutionary War. Without the Revolutionary War, Haiti wouldn't have been inspired to have their revolution. Without the Haitian Revolution, France wouldn't have been bankrupted. We'd still be the Louisiana Territory, and we'd probably all be speaking French. So there were huge impacts from having this access to variolation. And actually, it was used until vaccination was introduced later, but it was very effective. And so the concept of vaccination is something that's existed in the US for centuries. I also wanted to review the CDC guidelines on isolation versus quarantine. So isolate is the term that we use when an individual is sick or they've tested positive for COVID-19, even if they don't have symptoms. So we've defined day 0 as the day that you had your positive test, and day 1 is the first full day after your symptoms developed, or your test sample was collected. So day 0 is the day of your positive test or day of your symptom onset, and then day 1 is that first full day after you had a positive test, or you had your sample collected, or you developed symptoms. So if you test positive for COVID-19, even if you don't have symptoms, and regardless of if you had 1 vaccine, 2 vaccines, 3 vaccines, you need to stay home for 5 days. And if you do have symptoms, if you have been fever-free without any fever-reducing medicine, so that would be like Tylenol or ibuprofen, for 24 hours and your symptoms are improving, you know, kind of like you're at the end of a cold or you're at the end of a flu when your symptoms are really resolving or have resolved, then after 5 days, if you're in that state where no fevers, you're feeling almost back to baseline, then you can stop your isolation. And if you didn't have symptoms, you can end isolation after at least 5 full days after your positive test. If you have severe symptoms, or if you're immunocompromised, or if you're not certain about your status, you want to isolate for 10 days, consult with your healthcare provider before you end isolation. So in anyone where the doctor has said, you know, you're at a greater risk because you have immunocompromise, or if you were really quite sick with COVID, then your isolation would be longer. So you would continue your precautions until day 10. For everyone. So if you had a positive test, no symptoms. If you had a positive test and you had symptoms, you want to continue to wear a well-fitted mask for 10 days when you're around other people, like other people at home or other people outside of your home. Avoid going to places where you can't use a mask, and try not to travel for 10 days after symptoms or your positive test, and try to avoid people who are at high risk. It's really important because if there are people who are more susceptible to COVID while you're in that 10-day window, you want to try to delay those interactions until you're past the 10 days. And so quarantine is the term that we use when you've been exposed to someone who's COVID-19 positive, but you yourself are not yet symptomatic or known to be positive. So if you're not up to date on your vaccines, if you're exposed to someone who's had COVID-19, but you're not up to date, that would mean, based on the timeline of your vaccinations, if you were due for 2 shots by now and you've had your 2 shots, but you're not quite due for your booster shot, then you'd be up to date. If you were due for your booster shot and you've had your shots and you've had the booster shot, then you would be considered up to date. So in that case, if you're up to date, you don't quarantine. But if you are not up to date, if you've received 0 or less than the vaccines you should have for that timeline, then you would quarantine. So you would quarantine and stay away from others when you've had close contact with someone who has COVID-19. So if there are others in your household, again, wear a well-fitted mask around others, and you would quarantine and stay home for 5 days if you're not up to date on vaccines. And then the plan would be to get tested at least 5 days after your exposure. So let's say that, you know, you're exposed at work and the person in the cubicle next to you right there had COVID. If you're exposed at work, you want to get tested 5 days or more after exposure, regardless of symptoms. Even if you feel great, get a test. And if you develop symptoms in that time frame, you should isolate and get tested and determine if you do indeed have COVID. So again, with the quarantine, you want to continue those precautions. So, you know, if you've been exposed to someone, no symptoms, negative tested day 5, you're back at work, you're still going to be wearing that well-fitted mask for a total of 10 days when you're around others at home or outside of the home. Again, don't go places you can't use a mask. Don't travel for 10 days after your symptoms or your positive test. And you want to avoid people who are at high risk again. And if you are up to date on your vaccines, let's say you've had your 2 doses of Pfizer and your booster, 2 doses of Moderna and your booster, you've completed your J&J course, you've had a booster, then you don't need to quarantine, but you want to monitor your symptoms, make sure you're not developing any sick symptoms for 10 days after exposure, and again, get tested at least 5 days after exposure. And again, if you develop symptoms that are consistent with COVID, you should isolate and get tested. And again, continue the precautions till day 10, same routine, avoid people who are at greater risk, wear the well-fitted mask, don't go places that you can't use a mask, and try to avoid travel for 10 days. And if someone's had a recent COVID diagnosis, the other thing that the CDC recommends is that if you have had confirmed COVID-19 in the past 90 days, you don't need to quarantine. It's the same as if you were up to date on vaccines. So the same routine where you watch for symptoms for 10 days, you get tested at least 5 days after your exposure, isolate if you get symptoms, and again, avoid people who are at greater risk, Try to avoid travel, wear that good mask until day 10, continue the precautions till day 10. And the CDC has a link that I'll have in the slide deck and share with you guys that shows their current guidance on quarantine and isolation that we just reviewed. And when we talk about mitigating or reducing risk of COVID-19, one thing that's important is to conceptualize that vaccines are phenomenal and they're very, very effective. They're not 100% effective. So one way to think of this is a sandwich with layers of Swiss cheese. So your vaccine's highly effective, one little hole in the Swiss cheese. So very highly effective, but not 100%. So you want to get vaccinated as the guidance comes from the city or county, wear a mask. You want to continue hand hygiene, physical distance, avoiding large crowds while, as we continue to watch the cases trend down. So that approach of the Swiss cheese layering is really relevant for reducing risk of COVID. And I just wanted to briefly cover a couple of myths that have been circulating in the community. So one is, can the vaccine alter my DNA? It can't. The vaccines make your body make an immune response and make antibodies that are specific for the virus that causes COVID-19. It doesn't affect your DNA at all. So it's kind of like a Snapchat message in the sense that it says, this is the virus that we need to have an immune response to. The message is given to your body, you make the antibodies, the vaccine components leave your body. So there's no impact on your DNA. So the mRNA vaccines like Pfizer, Moderna, and the DNA vaccine like Johnson & Johnson do not affect human DNA. The other thing that's been going around is the question of whether or not the vaccine causes infertility in women. It does not affect reproductive health in women. That report's false, and actually if you try to look for it now, it's flagged as misinformation. But one thing that we do know is women who are pregnant who get COVID-19 have a far greater risk of ICU admission, hospitalization, stillbirth, preterm labor. So there are effects to both mother and baby that are concerning. And so what the American College of Obstetrics and Gynecology recommends is that women who are pregnant receive the COVID-19 vaccine, and they advise that you can talk to your OB-GYN about the vaccine and its appropriateness for you. The other thing is the COVID-19 vaccine does not affect men's reproductive health. What they do know is that for men in particular, if they develop long COVID, so between 1 to 3 out of 10 people who've had COVID-19 develop long COVID. This could be lung or heart symptoms. For some people, it can impact memory and thinking. Sometimes it can look like dementia. It can cause chronic nerve pain, fatigue, and a variety of other symptoms, including for men. Sometimes it can cause erectile dysfunction. So a small study was conducted in 2021 in Italy and showed that nearly 1 in 3 men developed ED following COVID-19 infection as compared to 9% of the population who hadn't had COVID but was similar in age. They also observed lower sperm counts in survivors. And this was not just ED where they could take a pill. This was erectile dysfunction requiring surgery in a lot of the cases to correct erectile dysfunction. And actually, when they looked at the pathology, they found that the virus causes impact long-term on the arteries and can affect the male reproductive organs in a more long-term pattern. And autopsy series for men who died from COVID also showed something similar. So again, it's the disease COVID-19 that can affect health outcomes for in pregnancy, and that can affect men's reproductive health. The vaccines are in and out of your system quickly. They do not cause any impact on reproductive health. So I just have for everyone, and we can provide a link to this, some other information about when you hear health and misinformation, how we can empower others in our social circles or in our communities to address misinformation, because health misinformation related to the COVID-19 vaccine has become very widespread, and we all can play a part in addressing it and eliminating it. Thank you so much for your attention.
Thank you so much, Dr. Williams. Dr. Williams, as Damon said, has been one of our champions on the medical side and always gives us great information. Today we talked about, and she stated, the history of the vaccine and long COVID. So I appreciate her so much as we hear from her on a bi-weekly basis, and she gives us great information. But just to move on, we have hopefully Mr. Eric Patterson on the call. He's the grandson of a subject of the United States Public Health Service syphilis study. And he's calling from a different state, calling in from a different state. And I'm hoping he can get on at this time. Mr. Patterson.
Yes, can you guys hear me?
Yes, we can.
Can you guys hear me?
Yes, we can hear you.
Okay, all right. Yes, just like Miss Grace said, my grandfather, Donald Brown, he was a part of the syphilis study, him as well as 600 other Black men. And when you talk about the Tuskegee syphilis study, just not a Tuskegee study, it was a Macon County study. And Tuskegee is the county seat, so that's why it really gets the name, but the study was actually out in the community of Macon County. And when you talk about the study, when penicillin was discovered, I want to say it was in 1943, they could have cured a lot of those 600 men, but they did not give them the penicillin because they wanted to study them to see what the virus was going to do and how it was going to affect the body. But when we look at that and what happened back there and we compare it to COVID, I think you really can't compare it because that was a study done with 600 participants, whereas COVID is just not a national problem, it's an international problem. And when people ask me all the time, do you think the Tuskegee Macon County syphilis study has anything to do with the reason why a large percentage of African Americans are not getting the booster and the virus, the booster and the vaccine? I'll say that has a portion to do with it, but on the grand scheme of things, when you look at pretty much from the beginning, like when we first got here, I'm talking about back in 1619 in Jamestown, Virginia, all the way up to now, Black people have been marginalized, exploited, and mistreated by these same people that supposed to have been out there for our well-being. And when I talk about different people, I look at the Center of Disease Control and Prevention and the Public Health Services. Now, these are government organizations that suppose Black people in America, it seemed like we just got bypassed in a lot of that. You know, when you take a look at it historically from slavery through Reconstruction, coming through the whole Jim Crow era, you know, you have a lot of mistreatment, which has led to African Americans not trusting government agencies. So in order to correct the problem, you know, you have to build some type of trust and some type of rapport there within the community. And I understand the fact when you look at, you have companies like Johnson & Johnson and Moderna and Pfizer say, okay, we care about you guys, you know, we want everybody to be safe and to be healthy, productive citizens, so we're going to give you this vaccine. But that's hard to believe because of what all that has happened over the past 400 years. So it's just hard for the community as a whole to believe that you have all these different agencies out here wanting to help me, and they're out here for my well-being. And historically, we've been marginalized and mistreated for so long. So I think in order to fix that, you need organizations like Moderna, Pfizer, Johnson & Johnson, and also local government agencies, state and federal agencies to work in the community to try to fix some of the problems that we have in the community. You know, and we have plenty of problems that were there way before COVID-19 hit. Because you look at, you know, inadequate housing, you look at education for public schools, you even look at the healthcare center in a lot of the Black communities, not just down here in the South where I'm from, but you know, nationwide. It's really bad. So I feel like if we can start working together collectively to fix some of these problems, we won't have a problem with Black community going out getting their vaccines and their booster shots. And that's all I have, you guys.
Thank you so much, Mr. Patterson. Great information, and I'm glad you talked about what happened in the past so that people are clear about their study. But something I neglected to mention, which is very important, is that Mr. Patterson served 2 combat tours in Iraq and Afghanistan, and he was a member of the coveted and historic First Brigade Combat Team in Fort Bragg. He is retired from the Army as a captain. And so we want to thank you for your service as well, Mr. Patterson. And we appreciate you on this call, being on this call to again give us more history about this study. And with that, we will move on to our next speaker. So she also is a descendant, and her name is Lily Tyson Head, who is the daughter of one of the 623 men who was a victim of the United States Public Health Service syphilis study in Tuskegee and Macon County, Alabama. Ms. Head is the president of the Voices of Our Fathers Legacy Foundation, which was formed by descendants in 2004. She has written several articles and publishes a newspaper for that organization. She has appeared on numerous national and local television news networks. At this time, Ms. Head feels that it is her calling and her responsibility to help others understand the need for vaccines during a pandemic. And that is something that her parents would have wanted her to do. So we hear from Ms. Head at this time. Thank you so much.
Good afternoon, everyone. Can you hear me?
Yes, ma'am, we can hear you.
Oh, good, thanks. It is indeed a pleasure and honor to be here today on behalf of Voices for Our Fathers Legacy Foundation and in remembrance of the 623 African American men unethically treated and victims of the United States Public Health Service syphilis study at Tuskegee and Macon County from 1932 to 1972. By celebrating Black history, we allow ourselves and the nation a short span of time to discover, remember, reflect, learn, heal, and grow. Our history, American history, if recorded justly, reveals our past, both good and bad. It uplifts our present and lights the pathways to our future. I am grateful today to be a part of St. Louis County Department of Public Health's Black History Month session on medical moments. The United States Public Health Service syphilis study at Tuskegee and Macon County, Alabama, is mostly known today as the Tuskegee Syphilis Study or the Tuskegee Experiment. The name of the study, when it started in 1932, was called the Tuskegee Study of Untreated Syphilis in the Negro Male. This was not Tuskegee's study, and its name should not have been in the forefront. It was the United States Public Health Service syphilis study at Tuskegee and Macon County. And I say Macon County because that's where all of the men came from who were in the study. By placing Tuskegee first, the ownership, responsibility, and accountability belongs to Tuskegee, and it should not. This name recording should and will change. Henceforth, let's all call and refer to this study as the United States Public Health Service syphilis study at Tuskegee and Macon County. It is essential that we acknowledge this study. We acknowledge that this study is only one of hundreds of racial, inhumane, and unethical medical treatments of African American people and other marginalized people for centuries in this country. As noted in Harriet Washington's book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. With prayers and by remembering and reflecting on our nation's history of healthcare and medical treatment to the underprivileged, and having informative events like this one, healthcare will continue to improve, but it still lags behind in accessibility, affordability, trustworthiness, and most important, trust in the system. The Public Health Service syphilis study lasted for 40 years. It is the longest and most egregious non-therapeutic study in medical history, and yet too few people have heard of it. Still, in this present day, this study shadows our decisions to get medical care, participate in biomedical and public health research. And yes, misinformation that exists about the study has stalled some in accepting COVID-19 vaccines to control or prevent illnesses and death. Not to mention the emotional scars of the men, of the descendants of the men that inherit this study. There are many layers and much entanglement, unknowns and unanswered questions about the Public Health Service study. The beloved 623 men were unwittingly lured into the study with lies, deceit, and promise of treatment for their bad blood. They were never told that they had syphilis, nor that they were not being treated. They were uninformed and did not give consent to be a part of a non-treatment study. The treatment for syphilis in 1932 and before to 1945 was mercury and arsenic. The men were not given even this crudest treatment. It is important to remember that the intent of the study from the beginning was not to give the men any treatment, and they were discouraged from seeking treatment elsewhere. In 1945, after penicillin was considered the antibiotic to cure this dread disease, the men were still denied medical treatment. The men were promised burial insurance if they would allow autopsies to be performed upon their deaths. The purpose of the study was to follow the men until death and to see the progression of syphilis in Black men to support theories and beliefs at the time that Blacks were subhuman and possessed a high tolerance of pain, and that Blacks had that the disease would not affect their cardiovascular system, but their neurological system, proving that of the less intelligent male. I have recently learned that biospecimens were obtained from 228 men upon their deaths. However, we have not seen any results of research data for 40 years of collecting blood samples and organ tissues. Where are they? How were they used? And what was learned? My father, Freddie Lee Tyson, was one of the 623 victims in this study. He, like other men in the study, had little formal education, Due to lack of opportunities, they were economically deprived, sharecroppers, lowly farmers, and lived in segregated rural Alabama under the rule of Jim Crow laws. One can only imagine how difficult times were. Just to survive was a hardship, and the social and racial injustices that prevailed were insurmountable. When the promise to receive medical treatment for their bad blood, a free meal on the day of testing, and transportation to the testing or so-called treatment sites were offered, this provided a once-in-a-lifetime opportunity for these trusting men. They believed, they trusted, and they expected the truth. Upon learning in 1972 from an AP News article by Jean Heller that they had been lied to, deceived, denied the truth, and used as guinea pigs for 4 decades, the 114 surviving men and their families in Macon County community were shocked and outraged, along with the nation in disbelief. 100 of those men had passed away before 1972, when the study was revealed, from symptoms related to syphilis and from syphilis, the disease of syphilis itself. Voices for Our Fathers Legacy Foundation was formed in 2014 as a 501c3 nonprofit organization by descendants of the men in the study at one of the annual 1997 National Presidential Apology commemorations that is sponsored by the National Center for Bioethics and Research and Healthcare at Tuskegee University. And this center is an outcome from the apology that was given by then President Clinton in 1997 to the remaining 8 men who were in the study. And the descendants have partnered with the center to ensure that nothing like this happens again. The purpose for organizing was to uplift the narrative of the study by transforming the legacy from trauma and shame to honor. We want to honor and triumph. We want to remember and honor the humanities of our fathers, grandfathers, uncles, great-grandfathers, cousins, and neighbors. They loved and they were loved. They were heads of households, providers for their families and extended families. They were ministers, deacons, pillars in their community, laborers, and I could go on and on. They, most of all, were humans, human beings, and deserve the respect worthy of every human, regardless of their race, education, social, or economic status. Moving forward from shame and trauma requires knowing the truth, prayers, acknowledgement, forgiveness, and healing, and positive actions. We cannot move until these things, in my opinion, are in place. The foundation is actively engaged in recording the untold stories of the descendants. We are awarding annual scholarships to descendants, encouraging them to further their education and particularly consider going into medicine and any type of healthcare field. We're planning a memorial and inspiration garden that will honor the men's humanity and offer a place for reflection and healing at Tuskegee University, where the men were so-called treated. We're also reaching out to other descendants around the country and the world, and to bring them into the fold to help us on our mission. We participate in an annual day of healing, and we hold the foundation's annual meeting. And most importantly, we are continuously searching for unanswered questions and unknowns about the study. And very importantly, we're collaborating now, which is something new, with medical school students at universities and talking with healthcare providers and medical agencies that aim to change old ways of teaching attitudes and practices in treating those who are in most need of equal and ethical healthcare. And I was quite interested in Dr. Khan when he was referring to the study and how to look at the study to make things better. I would welcome an opportunity to collaborate with him on some of his ideas. We are reminding, by doing something like this, and the nation, to never forget the sacrifices and the medical research contributions to these beloved souls. In so doing, we must connect to each other as we work together to create spaces for growth and trustworthiness, and building bridges that we can cross from distrust to trust in everyday medical treatment and the system. I'd like to share with you what my father said after he had learned about the study. A few days after it had been confirmed to him that he was indeed a part of the study, I asked him, how did he feel about being a part of such a study and being used in that way? My father said, baby, I cannot do anything about what has happened to me and those other men in that study, but it's up to you all to make sure that something like this never happens to anybody anywhere. And that's what we're all about today. Kindly visit Voices for Our Father's Legacy Foundation website at www.voicesforfathers.org to learn more about our work and join us as a member, supporter, or a donor. And thank you again for sharing your space, and to Mrs. Rochelle Gray for reaching out to me to be a part of this program.
Thank you, Ms. Head. Can you just expound a little bit on the premise that you all support the vaccine?
Yes, we, as Eric had mentioned, there's no comparison. And one of the reasons that we are so vocal about it is because of the misinformation that the men were injected with the bacteria that cause syphilis. And that, as far as I have seen, researched, heard, and knew a personal experience living with my father, they were not injected with syphilis. So that misinformation is given by a lot of members in the Black and Brown community as one of the reasons why they hesitate or will not get the vaccine. And we, I feel, are called to speak out against that and to encourage everyone who is physically able to get the vaccine or to get one of the vaccines to prevent deaths and serious illnesses in our country and around the world. And I might want to say, when you use that as an excuse, I just like to remind everyone, the men were denied an opportunity to get it. We are not denied an opportunity to get vaccinated. We might have doubts and concerns, but we are not denied. And those doubts and concerns can be addressed by reaching out to your medical advisors and doing your own reading and research on things. And at this point in time in the pandemic, we have visual evidence, and we see how the vaccine has prevented a lot of serious illnesses and also prevented deaths. So we encourage that, and that is one of the reasons why Voices for Our Father's Legacy Foundation have been called upon to work with this. And I see it as a wonderful opportunity for the descendants and the foundation to be a part in moving forward to build trust in the medical system. It's very important.
Okay, thank you once again, Ms. Head. You said it all, so I won't repeat that, but I do appreciate everything you said today. And we're gonna move on because we're running a little behind. And I wanna have, introduce, Dr. Latanya Collins Smith. She's the interim president with Harris Stowe State University. And she will give us a brief history of Harris Stowe because we are celebrating Black History Month, and give us a little encouragement.
Good afternoon, everyone. Thank you, Ms. Gray, for having me. I am truly honored to be able to be here this afternoon on this occasion and to learn a little bit more. As the only historically Black college and university in St. Louis, we understand that Harris Stowe plays a critical role in our community. We are committed to providing a high-quality educational experience that is both affordable and accessible and diverse within this metropolitan St. Louis region. We have evolved from a small teachers college to a university offering more than 50 degree and certificate programs. And Harris Stowe State University in recent years has seen record student enrollment. We've increased our partnerships and we've expanded our community outreach and programming. We are committed to being the champions in our community for under-resourced students, underserved students who with a Harris Stowe education are amplifying our STEM workforce. Since spring 2020, Harris Stowe has been a mask mandated campus in an effort to reduce the spread of COVID-19. We have partnered with Walmart, BJC, and other organizations to provide vaccinations to our students, our faculty, and our staff, as well as the community members here in the St. Louis region. And as a former social work and public health practitioner, I definitely support vaccination and the booster shots as well. And I strongly encourage our students and anyone else in the community to follow the recommendations of the Center for Disease Control and the recommendations of our community health partners, as mentioned earlier and as presented earlier. So thank you for this opportunity to share a little bit more about Harris Stowe. If anyone is interested in learning additional information, they may visit our website at www.hssu.edu. Thank you so much, Ms. Gray.
Thank you so much, Dr. Collins Smith. Very much appreciate you all's partnership with this program. Next, we have Reverend Gabrielle Kennedy, and she's the interim executive director of Faith Heals, and she's going to talk about what we know. We've talked about what we don't know. She's going to talk about what we know.
Man, thank you, Ms. Gray, and thank you to Mr. Broadus, and certainly to Dr. Sam Page and all of you who are on the panel today. What incredible information we've had an opportunity to hear. And as the interim executive director of Faith Heals, which is Faith Health Equity Alliance for Living Sacredly, our mission is to mobilize communities to improve the health and well-being of African Americans through health equity education that centers faith and healing practices. And so it was a no-brainer when we had the opportunity to be a part of this medical moment today. What we know, we've talked about what we don't know, and a lot of people are afraid of what we don't know. But what we know is that this work is important. And I know we don't like to think about what happened 2 weeks ago when we tried to do this the first time, but I got news for you. When you're doing it right, people try to interrupt what you're doing. Amen. I'm a preacher, so I'm gonna say amen. People try to interrupt what you're doing, and so our interruption means that we are doing something worthy of interruption, and we are on the right track. And so I am excited about bringing all of this genius together and intention together in one room, virtual as it be, that we've been able to do today, and so excited to be a part of it. We've heard the history and we've heard the data. We've heard our current condition. We've been given instructions on what to do, right, by Brother Patterson and Miss Head and Miss Newbern and Dr. Williams, and so we have all this information in front of us. And what we know is that Dr. King said all forms of inequality, injustice, and health are bad, but healthcare is like the most shocking and inhumane. But what I think is even more shocking is self-imposed inequality. Self-imposed inequality, and some of that is what we're seeing today. And so what I'm hoping is that we can come together so that we can get past that. What we know is that the 600 plus gentlemen from the U.S. Public Health Study at Tuskegee and Macon County, Ms. Head, I'm gonna change that name, didn't have access to healthcare the way we do now. We don't have it the way we should. Again, we don't have it the way we should, but we have more access than they did. This is one of the things that made them vulnerable, is that they didn't have anybody there in their community who was a healthcare advocate or healthcare resource for them, but we do. They had little or no opportunity for health education, but we do. They had very few people advocating and participating and breaking ground in the sciences that looked like them or had their best interests at heart, but we do. People like Dr. Kizzmekia Corbett, a viral immunologist who happens to be a sister, was the lead for developing the coronavirus vaccine, specifically for Moderna, that we now know has served as a foundation for us to fight against the vaccines, but to fight for our own health. And that's the place that we want to be. We want to be in this Sankofa moment. Amen. Y'all know the bird that is faced in the direction, but looking behind, the Sankofa moment that looks back, right? So that we can fetch these lessons that we have gotten when we talk about the U.S. Public Health Study at Tuskegee and Macon County. When we look back at what happened there, that we grab those lessons and that we move into the future. The Sankofa bird has an egg in its mouth, and that represents the richness of what waits for us in the future. The men in this study didn't have what we have now. So let's use what we have now. Let's use this opportunity, as Ms. Head said, to move to honor and triumph from shame. Let's reflect on the decisions that we can make for our own health. It's said that what makes up our health, only about 20% of that is in the healthcare industry. But that leaves like an 80%, a whopping 80% for socioeconomic and our environment and our atmosphere. But also what's in that 80% is how we make decisions about our own health. And that means something. So let's move away from the fear and let's move into this time where we can insert things that allow us to know more, to get more access because we know more, and to believe that we can do better for ourselves, for our children, and for our children's children who are not even here yet. Let's move into a time when we can create access and when we can begin to have these conversations on a regular basis. Some of this distrust we have right now is because we haven't been talking about health. We only talk about health when something goes wrong. And in the last 2 years, something big went wrong, y'all. And so now that we have this opportunity, now that it's centered in front of us, let's continue to talk about our health. let's continue to move on to honor and triumph. Thank you all for having me, and I'm looking forward to things that we will do to continue to make our community a safer and healthier community.
Thank you, Reverend Kennedy. Thank you very much for your continued support, encouragement, and faith ministry. You've been a champion again for this past year or longer, and we just thank you for the insightful message you brought to us today. With that, for the next few minutes, because we have been running behind, we will transition to our question and answer session using the Q&A box. If you have questions for our speakers this afternoon, excuse me, we ask that you submit your questions using the function, and Sarah Daly, Department of Public Health Public Information Officer, will help facilitate posing those questions to our panelists. So Sarah, please take it away.
Okay, at this point, earlier we did have a question about the study that showed that 30-year gap that Dr. Khan presented. So I did send that out to a couple of folks. If you're interested in that, please just list your email address in the chat box, and then we can get that to you. Otherwise, we don't have any questions listed at this time.
All right, that shows an exceptional job that all of our speakers and hosts have had today, and we thank all of you again for joining us and sharing your time, your talent, and your treasures. And in closing, I want to share that we at DPH extend our gratitude and appreciation to all of you that have been involved in today's public health update, to our North County Outreach Group, which is a coalition of over 30 partners who helped us create a framework for acceptance and uptake of the COVID-19 vaccine for Black, Indigenous, and other people of color, our immigrant communities, people with functional needs, and the unhoused. Over the last year, we relied on prominent leaders from the faith community, housing, social justice, social services, and educational institutions to include school districts. Local school districts have been highly involved in our vaccine efforts, as well as universities like Harris Stowe State University. And they've all been working in collaboration with us, our medical providers. Dr. Williams, again, we want to acknowledge your ongoing support to address vaccine equity and availability, vaccine literacy, to overcome reluctance. We don't like to say hesitancy. We talk about reluctance because it's rightfully so. Given the history that was shared today, we have a better understanding of why the African American community and other communities of color are reluctant to get the vaccine. These partners helped the Department of Public Health, our efforts to center equity in everything we do to increase access and address the social determinants of health, housing, education, and transportation needs. Again, we thank you for taking the time. Our goal for 2022 is to continue partnering with the faith community and other partners to increase vaccine confidence with people and communities of color with low vaccine participation rates by providing events that are easily accessible across the St. Louis region. Throughout the remainder of 2022, we intend to go beyond COVID-19 to address what we as public health professionals call those social determinants of health, focused on addressing chronic diseases like high blood pressure and diabetes, and to devise strategies to address substance use disorders and violence prevention. As said during today's conference, the COVID vaccine is critical to keeping children, adults, and communities safe. So please get vaccinated, get boosted, and take care of your family. We invite you to visit DPH at revivestl.com. That's our source for all things COVID related, for vaccine information and clinic information, locations, clinic information, and events near you. I'd like to invite you to reach out to Rochelle Gray. She is our COVID-19 vaccine acceptance community outreach coordinator. If you're interested in partnering with us, you can reach her at 314-565-1262 or via email at rgray@stlouiscountymo.gov. Again, we thank you for your participation in today's webinar and hope that you stay safe and warm.
Thank you.
Thank you, everyone.
Take care.
Thank you all. Have a great day and be safe. Thank you so much, Mrs. Head.
Yes.
Thank you.
Excellent job. Thank you all.